Right.
All right.
All right. We
Yes.
good?
Yes, sir.
All right. In the name of Allah, the beneficent, the merciful, I bear witness there's no God but Allah, and I bear witness that Muhammad is the messenger of Allah. This is a dialogue or conversation. My name is Brother Dr. Ishmael Muhammad. Most people also know me as Ishmael Murray. And I'm here in the Baltimore, Maryland area. And I'm also a practicing holistic practitioner of Chinese medicine and naturopathic medicine. So I have with me Brother Jabril Muhammad, esteemed scientist, and we actually met this week doing an actual COVID-19 kind of session for the Freemason community here in Baltimore, and I think even regional wise. And so we just wanted to kind of get together again and have a discussion about the COVID-19. So, Brother Jabril, why don't you give us some background on who you are? Because I think the reason why I wanted to do this is because I think folks in the Nation of Islam specifically need to know who you are, and that you also are one of us. You're a scientist, and that you're not just a scientist or a doctor by name, but you're qualified and you are a virologist. And because a lot of us are getting our information from the media, I thought it would behoove us to actually have the community of believers to get familiar with who you are, and let's have a real straightforward dialogue about this COVID-19, and also some things that we probably can do to limit the continued spread of this virus. We just lost our beloved minister and brother Abdul Hafiz Muhammad out of New York. So we know that this is not something that's indiscriminate. We know that this is not a virus that's picking on just the wicked in society. It's also affecting the righteous and those people who are believers as well. And if believers don't take precautions and worry, and use wisdom and discernment, that we can end up getting this as well. And so we really need to exercise discernment, especially in light of the fact that a lot of the state governments are starting to open up, and they're starting to open up their borders and businesses, and there's still a possibility that there could be a big spike, another spike with this. So I just wanted to have this dialogue with you and kind of like make this available for our ministry, and also for the believers who are in our friendship pool, so that they will be able to spread the word, and exercise precaution as we're going forward. So, Brother Jabril, if you could just introduce yourself and your background, and your training, and in virology and so on, and then we can go on from there and chop it up a little bit.
Yes, sir. So here's a little clarification about my background. So I received my bachelor's from University of Maryland Eastern Shore in biology, where I began my virology background. I then went to Howard University, was accepted into Howard University's Human Genetics, Molecular Genetics program, where I extended my background in virology, dealing with prostate cancer etiology. I was dealing with a virus at the time called XMRV, xenotropic marine leukemia-related virus. I'm very familiar with viruses, both, let's say, created by man and or mistakenly created by man. Nonetheless, I continued my education in prostate cancer etiology, breast cancer carcinogenesis. I did my postdoctoral research after receiving my doctorate from Howard University at the National Institute of Health, National Cancer Institute. And now I am continuing that postdoctoral research here in Duarte, California at City of Hope, underneath a Dr. Rick Kittles in prostate cancer research and population genetics. So my title is a researcher of biomedical research in human molecular genetics / genetics.
Awesome. All right. So let's just dive right into this about the COVID-19. What is COVID-19? What does it mean? When you hear that terminology being thrown out, what is COVID-19? And why is it given such a title name?
So COVID-19, it simply stands for Coronavirus Disease 2019. That's pretty much what it means. I mean, it is the actual disease. A lot of people are using it interchangeably with the virus, but it itself isn't the virus. It's actually the disease. So the virus is called SARS-CoV-2. SARS being short for severe acute respiratory syndrome, coronavirus 2. The nomenclature 2 is because we've seen something similar like this in previous history, and that would be SARS-CoV-1 that gave the disease SARS, the breakout of SARS in 2003 in Hong Kong. So the virus was called SARS-CoV-1 or SARS-CoV, which is severe acute respiratory syndrome coronavirus. And now, since genomic analysis have seen something similar to this, with a slight mutation, we call it SARS-CoV-2. That's not to say that all of the coronavirus or the coronavirus strains are identical, because they aren't. This 2019-2020 strain is similar to the 2003. However, there's other coronavirus strains that are quite different that also presents with different diseases, such as MERS, which broke out in 2012 in the Middle East. And that too is a coronavirus strain, but it's unlike the two that we are familiar with now.
I see. So let's talk about the seriousness of this, because a lot of people are, in fact, getting infected. A lot of people are dying. What makes this particular virus so devastating? And what can we do to keep ourselves, I guess, safe, until such time that they can come up with some type of I know you and I had talked about this earlier, that there's talk about vaccine. However, you believe that vaccine is not the answer, that we actually need medication to deal with this. So elaborate, if you may, about that.
Yeah. So I'll start off with your first question, which was, what makes this so dangerous? Yes. In studying the virus in depth, what's very interesting, piggybacking off of what I said before, SARS-CoV-2 is very similar to SARS-CoV-1. The only difference is that there are genetic enhancements, such as mutations found in the spike region. And I'll get into the anatomy and physiology of the virus itself later on. But the main idea is that when one goes into the historic epidemic that occurred with SARS back in Hong Kong 2003, what they found is that the virus attaches to the ACE receptor or ACE2 receptor that's found on epithelial cells in the oral and the nasal mucosal lining, right?
Mm.
What's interesting is that SARS-CoV-1 primarily only replicated in the lungs, primarily, which is why they were able to denote that as being severe acute respiratory syndrome, because for the most part, when people were infected with the virus, the niche of the virus preferred the lungs. So the epithelial cells in the mucosal lining of the lungs and the bronchial lobules was primarily the place where it wanted to replicate and become full blown. However, with this virus, quite interestingly, it not only prefers the lungs, but it also utilizes the ACE receptors of the epithelial cells in the nasal and the mucosal lining of the oral cavity. So now you have a situation where the virus prefers to give a person upper respiratory tract infection as well as a lower respiratory tract infection. So that's where you have people ranging from symptoms such as anything from nasal congestion, loss of taste and smell, unable to breathe, mucus buildup, sinus pressure, all the way down to sore throat, coughing, all the way down to the lungs, tightness of the chest, unable to breathe. And then what happens is that the virus causes so much damage to the tissue, the epithelial lining of the lobules of the bronchial tubes, that you have inflammation. And then the inflammation turns into pneumonia-like symptoms. And then ultimately what happens is that you have something called ARDS, which is acute respiratory distress syndrome, which ultimately is what's causing the death or the lethality from the virus itself when it comes to individuals of either older age and or underlying conditions. ARDS, or the complications of breathing with the lungs, is what ultimately causes the lethality, right? So that's what makes the virus dangerous. It's able to infect more epithelial cells that has the expression of this ACE2 receptor. So, and even more so the case, what's being found now is that
Brother Jabril, I think you just went froze.
Can you see me? Can you hear me?
Are you there?
Can you hear me now?
Okay, yeah, you froze for a minute.
Okay, so what I was saying was that even more so, that this virus seems to have an effect on other organs as well. So in addition to it having an overwhelming, insurmountable effect on the lungs, it's also affecting the heart, kidneys, and liver. Not to say that the virus is necessarily affecting or infecting these tissues, it's just the amount of pressure and the amount of complications that arise in the patient causes secondary complications with these organs. So a lot of people asked me the question, they said, well, why are hospitals, or why is the protocol telling them to place on the death certificates that they are dying from COVID-19, even if they may have died from something else? Well, the real answer to that is this. I mean, they don't know what the death is from. If they have been positively affected and infected with COVID-19, then you have underlying complications such as hypertension, heart attack, or whatever the case may be. They are unable to say that if the death is correlated to the COVID-19 or if it's separated. Because of the overlapping symptoms and because of how many organs this virus seems to be affecting in addition to the lungs themselves, you cannot primarily say just because they have ARDS and ARDS seems to be the lethal blow, that COVID-19 and ARDS, that's the sole connection there, right? People are dying from heart attacks, but now we're finding that the heart has something to do with the infection of COVID-19. You know, so if you have a heart attack or if you have liver damage or kidney failure and shutdown, who's to say that it's not related to COVID-19? So it becomes one of those difficult it becomes a difficult situation, because one would look at it as the hospitals are padding the numbers as far as the deaths from COVID-19, when in reality, COVID-19, or rather SARS-CoV-2, is affecting so much more than just the liver, as far as the lower respiratory tract infection and ARDS that the patient undergoes. Furthermore, we were talking about the ventilation situation. So what makes this virus very dangerous is the fact that if 80% of the population ends up being asymptomatic or presented with mild symptoms, and you have 20% of the population that ends up hospitalized, right? And in this hospitalization period, you have half of those 20% that ends up on ventilators. Due to the protocol that the hospitals were using at the time, they used the ventilators for patients in the late stages of breathing complications. So the ventilator, the main use of the ventilator is to force air into the lungs, to force the patient to breathe.
Right. So that was the protocol.
Right. So what happens is that when the lungs are already struggling with the constriction of breathing, damage to the bronchial lobules, inflammation, and the presentation of ARDS, what then happens is that the ventilator forcing air into the lungs causes more damage, and it exacerbates the damage of COVID-19 to the point where if you take the person off the ventilator, they will not be able to breathe on their own. And that too also is part of the lethality of the virus. So hospitals have now, they are in the process of changing the protocol to use the ventilator earlier on in the infection process to assist in the breathing before irreversible damage of breathing takes place in the patient.
I see. So what can people do? Because, you know, of course, since December of 2019, I've been noticing people having what would be considered a COVID-19, but at that time, of course, they didn't call it COVID-19. I mean, the flu or pneumonia-like symptoms would last a lot longer. I've been basically telling a lot of clients of mine to boost their immune system and to basically stay away from mucus-forming type foods that would affect the lungs and affect the respiratory system as well as the upper respiratory system. Is there anything that we can do? Is what I'm telling people to do. Can that help them, or is only part of the equation?
Right. So the main issue when it comes to viruses in general is that it's I guess the conversation of protection and prevention is twofold, right? So most people have to keep in mind that viruses are microscopic, if not nanoscopic, right? So the idea is that the first line of defense, in my mind as a scientist and as a researcher, which is why we disinfect so much even in the laboratory setting, is pretty much distance. And this is where the idea of social distancing came from, right? To avoid the possibility of even coming in contact with the virus to begin with. So social distancing to me is the first line of defense, avoiding individuals that are infected. The second line of defense that comes into mind would be utilizing PPE or the protective equipment that we've talked about, such as the gloves and the mask. Of course, K95 is the best. Beneath that would be surgical, and beneath that would be procedural. Anything less than that would be almost like not wearing anything.
So let's talk about that briefly, because that's important. When you say K19, what are we talking about? What type of mask is that?
So K95 masks are pretty much the masks that the CDC initially came out with as far as the recommendations that individuals should use. It's pretty much filtration. It's pretty much the maximum protection for filtration and respiration regarding viruses, pathogens, germs, so forth and so on. It is not to say that it is the best of the best, because there's also masks that goes beyond K95. K95 is just something that would be your bare minimum as far as the best for respiration and filtration of pathogens and particulates that are in the air from, when people talk, breathe, cough, so forth and so on. So that's the minimum. K95 is the minimum. There are definitely things much better than that to protect you, but that's for BS levels, for laboratory settings of BS level 3 and 4, when you're dealing with direct contact of viruses, so forth and so on. But for the public, K95 is the bare minimum that is necessity as far as filtration. 99.5% effective rate. Beneath that would be surgical, and I'm sure people have seen surgical masks before. The green mask, it has the level of filtration necessary to block saliva particulates that individuals may breathe on you, so forth and so on. It's a little less effective than that of the K95, but still good nonetheless. And then underneath of that would be procedural. Procedural are your blue mask with the filtrations within it. Not as good as the surgical, not as good as the K95, but good nonetheless. And anything beneath that is just, it's like wearing nothing, at that point.
So the masks that people are making, like they're making these crochet masks and and bandana masks, are those effective?
Not if they're not utilizing the base, as far as let's say they're using cloth over a procedural or over a surgical. But if they're just if they're just sewing together cloth as a mask, no, that's inefficient.
Okay, got you. So in terms of boosting the immune system,
right,
and taking upper respiratory type preventatives or formulas or herbals or homeopathics or over the counters and things of that nature, or just in general, just boosting the immune system, what's the probability of a person whose immune system is heightened to contract COVID-19? And I say this to you because back in December, there was a family that I visited, and it seemed like all of them had the flu. Of course, at that time, it wasn't called COVID-19. And I don't know if they had COVID-19. It just appeared to me that it was the flu. And one of the things that I noticed is that after going and visiting with them in their home, about a week or so later, I still wasn't sick. I didn't have any symptoms, and mainly I attribute that to the fact that I tried my best to heighten or boost my immune system, so that I wouldn't catch these colds or viruses or bacterias. Is there any validity in that for the layman or for the person, or in addition to social distancing and just being wise and circumspect in our and listening to the experts, not listening to politicians, but listening to the experts who are telling us that it's not time for us to move out there yet and get back to normal as life was maybe 4 or 5 weeks ago.
Right. So, two things. The first is that we're unable to say for sure if the immune system or if these supplements of the immune system is responsible for the 80% that seem to be asymptomatic or to present with mild symptoms. That's interesting as far as I'm concerned. It's speculative at best. I would say that it's very plausible. It's very plausible that these 80%, the 80% boosted or have immunity regulation to the point where even if they do contract it or they're infected, the virus itself is unable to take them down completely. That is very plausible, to the point where, you know, if you're talking about vitamin D, and we'll talk about the individual supplementation, but vitamin C, vitamin D, elderberry, you know, lysine, all of the gambit of things that one could take to boost the immune system, it's very plausible that it is those reasons that an individual isn't taken down 100%. As far as not contracting it, and if you're in the environment of it, as far as the virus itself, you will be infected. The question is, how bad will you present with symptoms? How will you be taken down and how long? That is the issue. As far as boosting the immune system, it won't stop the virus from attaching itself to the ACE receptor and then integrating itself within the cell to replicate. It won't stop that. However, the immune system being optimized due to whatever it is that you're taking could, in fact, stop it at such an early point where you only present with mild symptoms. And as the virus is constantly being killed, it pretty much rides out its life cycle in such a minimized viral load that your body doesn't even feel that it's there. So
Right.
the immune regulation could be the reason 80% of the population, you know, they are either asymptomatic or presenting with mild symptom, which then furthers the notion or furthers the idea that if you have underlying complications that impact the immune system from being optimized, that is the reason that you find yourself presenting with symptoms that are exacerbated at that point, risking the upper viral infection becoming lower.
Right. Okay. Okay. And now I want to take a little turn because there's a lot of conspiracy theorists out there that are in the media or on social media that are causing people to believe that this is a caused by the 5G cell phones. And I'm not saying it's not. I don't have any evidence of that. Okay. And of course, some people are calling it a plague from God. You know, and of course, you know, some people are just kind of running out there and doing social media type you know, interviews and things on the web and speaking about this from a more purely emotional standpoint instead of a scientific medical standpoint. Would you say, what would you say to the individuals or to the public about, in terms of this being some type of something being created in a lab and being released into the population for population control, or, you know, what's the validity of this whole 5G from a virologist standpoint, from the medical standpoint? Does that have any validity or hold any, can the 5G radiation cause molecular issues in the cells which could make it worse, or is any validity to that at all?
All right, so you've touched on a lot of different points. You touched on a lot of different points. So I'll start with the 5G situation. Okay, so all right, we're gonna start with 5G, and I'm going to converse about it a little. From a medical standpoint, from a scientific standpoint, rather, right? There is a condition which those that theorize that radiation is causing this, there is a condition that mimics what we are seeing somewhat. And that condition is called radiation pneumonitis, okay? radiation pneumonitis is the effect of radiation poisoning on the body, preferably the lungs rather, and this is what we call pneumonitis, right? So the flu-like symptoms that we see, or the pneumonia-like symptoms that we see, those that theorize radiation is doing this, they're saying that because it looks like flu-like symptoms, or it presents like pneumonia-like symptoms, but the virus isn't that, right? So they're saying that radiation is causing it. Well, there is a situation where there are a certain type of people that will get radiation pneumonitis, but you'll find those patients more so to be cancer patients after they receive radiation therapy, in addition to their chemo. Their radiation that they receive, by no length of their imagination, isn't radio waves. Let's make that clear. It isn't radio waves, which 5G, 4G, 3G, 2G, even if down to 1G, they are radio waves. So the conversation that I would have from a scientific perspective, and I'm not here to debate on what is versus what isn't, I'm simply here to present scientific fact. And if we can discuss and converse upon that, then I'm willing to do so. But I'm not here to argue, anything much more than that, right? So if one were to Google and pull up the electromagnetic spectrum, they'll find a spectrum by which we understand and identify the impact of wavelength, okay? And really it boils down to radiation and wavelength. So further to the left side of the spectrum, the less dangerous side, you have wavelengths that appear to have greater peak and a greater valley, right? So the greater the distance between the valley and the peak of the wavelength, the less dangerous, right? And so therefore, further down the spectrum, you have radio waves, okay? And anyone can pull this up. So you have radio waves, and as the valleys and peak become shorter and shorter and shorter, you're representing, or it represents, the concentration of the radiation. Therefore, the increased damage, right? So from radio waves, the next thing you have is a microwave. Microwave, you have infrared. Infrared, you have visible light. Visible light, you have ultraviolet light. Ultraviolet light, you go to X-rays, X-rays to gamma rays, okay?
Right.
Now I say all of that to say this. If a microwave is more powerful as far as radiation concentration than that of radio waves, right? Microwaves have been in our homes for half of a century, right? And microwaves being in our homes constantly plugged up, you have not heard, or I have not heard of, we haven't seen any cases of those people and or myself or anyone else that presented with radiation pneumonitis. And people microwave their foods all the time.
Right.
That's number one. That's number one, because even above microwave, you have infrared, visible light. Visible light and ultraviolet light and infrared light, as they're very similar as far as the proximity. Infrared light is beneath visible light. Ultraviolet light is slightly above. But visible light, when you go outside, is presented by the sun. The sun gives you infrared, visible, and ultraviolet, which is far more powerful and dangerous than that of radio waves, which is why they tell you to go out there with sunscreen on, because you can get skin cancer. And although Black folks believe that we are immune to skin cancer due to the sun and ultraviolet light, there are proofs and there are data out here that shows and proves that melanin may slow the process, but it does not make you immune to skin cancer etiology and development. Right. So my point is that 2G, 3G, 4G, 1G, 5G, they're all encapsulated within this radio wave spectrum, which is far less powerful than that of your microwave, your infrared, visible light, ultraviolet light.
Okay.
So the second thing that I'll say is this too, and this is just based off of ration. if we were to look up the actual map, if we were to look at the map as far as the 5G rollout, the 5G rollout occurred like in 2018, okay? 2018 up until current time. You're gonna have to explain to me based on the map of, and people could Google this, the national map as far as how many 5G towers are here and international towers there are in the world. You're gonna have to show me travel-wise where the 5G towers are and the cases and deaths that we have from the COVID-19. Do they correlate? And my only question is this, I'm not here to argue. When America, we could just leave it at America before we even talk about international. Before we even heard about the cases and things of this nature, right? The 5G towers in America, they were positioned already. They're here, they were here already. Ironically, the first place that had the first case and death was in Washington State. Correct? That was the first epicenter.
Right.
Now, if one were to Google where the 5G towers are, you'll find in no limit of time that Washington State doesn't have 5G towers. So if there is a correlation, and that was the first place that showed it, then why would individuals have cases of flu-like symptoms and pneumonia-like symptoms and be dying from 5G if indeed they're in a place where no towers exist? Same thing with Chicago. Same thing with Louisiana. Now, that's not to say, and again, I'll further this by saying that there is a lot of evidence to show and prove that radiation impacts the body in a negative way. There is evidence to show and prove that radiation, consistent placement next to radiation, has correlation and association with cancer development. However, we're talking about radiation pneumonitis. As far as that condition, there doesn't seem to be a correlation at all between that. Therefore, taking the virus for what it is as a separate issue, separating it from 5G is what's best for the survival of the population, because if you blame it on 5G towers, you continue to live your life haphazardly in the idea that this virus isn't transmissible from human to human, and I should be focusing my attention on the towers that are in other states, so forth and so on. So that's my take on that.
Excellent. So in terms of our governors, or of course the president of the United States saying that he's going to allow the governors to go ahead and make the decision as to whether or not to open up and to begin. Just personally, I believe that is, more of an economic decision, or more of a dollars and cents, decision than it is a medical or scientific decision. From watching the COVID-19 updates, you could see that he wants to open up the country because of the dollars that the country is losing and the business that it's affecting. Understood. And of course, we understand that people want to get back to normal, and people want to get back to their regular lives, or, as he calls it, cabin fever. People have cabin fever. But do you think it is wise at this time? Because I don't think it is. I don't think that it's wise at this time to go back to normal without further testing, or at least, without relying on our scientists and relying on our medical personnel who are qualified and who are trained to study this thing and understand it before we end up with another spike. I think that it's not prudent for us to just go back to where it was right away. What's your take on that? do you think we should just remain, continue with the quarantine, continue with the social distancing, and wait it out until we could get some definite data and feedback as to, or if you know, because I have a feeling that I think that what's going to end up happening, and this is just my personal opinion, is that people are going to get comfortable and go back to normal, and that there is going to be another major spike that's going to take out more people. So, I mean, I don't know. This is just all opinion.
Yeah. I think the conversation right now is it has been split between politics, science, economists. You know, it's interesting because at the end of the day, the only reason why you have so many different conversations happening at the same time is because people have different agendas. You know, the scientists or the researchers, their agenda is to make sure that, you know, the public is safe. Politicians, at the end of the day, they want to make sure that the economy doesn't fall below a certain threshold, that America isn't seen as a superpower anymore.
Right.
Because, you know, her superpower status have been placed in question recently by India, you know, Putin. Many different countries have placed America in this, I guess, in an uncomfortable position, because based on how we are operating at the time and the decisions of the government here, it is seen as inefficient, ineffective, and other countries are now seeing it as possibly being obsolete. And with that comes political pressure, because if America falls behind as being an influential leader from a global standpoint, then that has far more consequences for the United States livelihood than one would imagine, right? So that's the political conversation. And then you have, from an economic standpoint, individuals stating the losing or the loss of power of the dollar, the collapse of the system, which then funnels into geopolitical conversations, as in, you know, what we just talked about regarding the countries and being a superpower. So it's hard to answer, because I understand people's agendas. I get it. You know, I 100% understand. I understand that people's livelihood at this moment in time, I mean, you're talking about unemployment rates that have skyrocketed. You know, this has been insurmountable as many individuals have filed for unemployment at this very moment in time, those that have been furloughed, those that have lost their jobs permanently. This is unprecedented. So people have families, people have children. I get all of this. I really do. And that's what makes this conversation or this topic difficult to discuss, because people aren't looking at it from just one way. Or if they are, they're only looking at it from their way. And that's the problem, right? So the ideal situation would be to, of course, you know, wait it out, because there has been so much speculation as far as multiple strains that are here, as far as the SARS-CoV-2. There seem to be different strains that have already mutated from the first time that we've encountered it. They're talking about possible reinfection, and not sure if the reinfection is due to being infected with the same virus again through transmissible of another human being, or if the virus never left the body, or if the test picked up inactive fragments from the virus previous. They're unsure why people are getting reinfected in Korea, China, and other places. They're unsure. And even some cases here in America. The lack of testing, the inaccuracy of the testing, there's so many variables as into why it's not safe for individuals to reopen their borders as far as the governors are concerned. But at the same time, I can see why individuals are taking other stances beyond just the safety of the public that they serve. I heard the conversation with the mayor of Atlanta yesterday or last night and the governor of Georgia. So apparently the governor of Georgia decided to make that proclamation without the consultation of really the mayor of Atlanta. And she was just as shocked to hear it as anyone else. Now, the mayor of Atlanta personally felt as if they weren't ready due to all of the variables that I presented before you. But the governor had a different perspective and a different stance on the issue. So that's ultimately what's happening now. You know, you have the scientists talking from a specific stance. You have politicians. You have your economists. You have everyone that has an agenda. And ultimately, I think the livelihood of the people should be the first priority, which it isn't at the moment. So do I think it's a wise choice to reopen the borders? No, but that's why you have governors like, you know, Governor Hogan of Maryland, my old state from where I come from. His statement was, we're not listening to politicians. We're listening to the public health officials. I believe the same notion was held by the governor in California. So it's certain governors have different perspectives. The governor of Texas, I know, feels similar to the governor of Georgia, and there's other Midwestern states that feel similar to reopening that border before May 1st. So, you know.
Well, let me ask you this. You know, being that we're a nation within a nation, and, you know, being that if you had an opportunity to brief our head of state or, you know, the minister, you know, and you know, give him a briefing as to what is going on, what would your advice be, so that we could, you know, move out and have good instructions so we can move out safely? What would be your advice to the minister?
Honestly, I love what, you know, the head of state have done thus far. You know, from what I've been reading, I've read all the instructions that have been passed down to me. Everything from making sure that your home has the amount of food and water necessary to survive for a couple of weeks to a months to 3 months or so. The instructions as in not to speak unless you are qualified to speak on certain issues. Therefore, to limit the amount of misinformation and the amount of conspiracy theories that may interfere with people's livelihoods and their ability to respond to the emergency at hand. Instructions such as the most recent one, where he wants a tally or total of individuals that have been infected in the nation. And for those that have been affected or exposed, he wants those numbers. You know, so I believe that's what I've heard so far is exactly the type of things that I would have stated. Furthermore, I think what I would have added or would add is, which I believe will be done, but the coming out in front of the presentation for the nation as far as the data, the real data, the scientific data. We could speculate at any particular time what the virus is, where it's coming from, how it originated, but just the actual data regarding how to defend, properly protect, how to build the immunity, that is what I would believe is priority as far as the addressing of the nation, and what I would honestly be honored to brief in, because the biological essence of it, the biological function of the virus, I believe is swept under the rug because the priority for most people is to speculate where it came from, how did it get here, who's responsible, shifting blame. And I think it's more important to understand how to defend, how to survive, because it is something to survive. This isn't a death sentence. you know. And I think ultimately what happens and what people have a misunderstanding is that when you get wrapped up, and this is something that the minister talked about, when one gets wrapped up in the theorizing of the conspiracy, so to speak, you lose focus of the situation at hand, right? You lose focus of what's at hand. And the panic rises so much to the point that it makes you irrational. It makes you irrational. Prime example would be, I started reading reports about people in the UK that were burning and exploding 5G towers. Now, if that same energy was redirected into protecting oneself and social distancing and things like that, it would be more of a chance of the curve being flattened as far as the death to cases, and surviving and gaining what one would call herd immunity, or gaining a long-term immunity to this, right? But instead, because there's so many different theories, so many different speculative ideas, we take our health at this moment in time to be secondary, tertiary to whatever it is that we believe at the forefront. Right. And so, yeah, you know, I'm a human molecular geneticist. You know, I am a geneticist by trade who has expertise in virology, and I'm solely a researcher in the objective sense. You know, that's what I care most about. So we can talk about the other things, connecting the dots after that. We can deal with that after the fact, but it's most important that we brief. You know, well, it's important that we get debriefed on the biology of it, the epidemiology of it, the circumstance that we currently face in our individual states, because every state isn't the same, right? So the believers, the believers in the different states may face a different reality than that which is presented from the country, right? New York is definitely different than Wyoming, but believers live in both parts. You see what I'm saying? So I think that needs to be taken into account as well. And so, yeah, that's something that I would say would be important to brief the nation.
Right. So what in terms of, I know you and I, for the past few weeks, we've been chopping it up in terms of what are some things that we are taking personally ourselves to help ourselves to, you know, until such time they come out with some type of medicine, not a vaccine, because you and I had talked about this whole vaccine thing, that if they came up with a vaccine, you don't think that would even,
no, you know, it's too, minus the fact that it's too quick. Minus the fact that it's too quick. I mean, shout out to our dear sister who's the lead vaccine person at the NIH. You know, the sister's very intelligent. I haven't had the chance to meet her when I was working at the National Institute of Health, but I know that they do amazing work in the vaccine department there. However, you know, what we know, especially being that of the nation, we know that the ingredients at this moment in time for that which are in the vaccines aren't necessarily proven to not do damage long term. And see, that's the argument. I don't think the argument is whether or not we can survive a vaccine. Of course we can survive a vaccine. The argument is whether or not they have detrimental effects long range, long term. And we're talking about ingredients such as nickel, metal poisoning, foreign elements that our system isn't necessarily used to, that may cause liver damage, kidney failure, things of this nature. So, yes, minus the fact that this is way too quick and normally takes 6 months to a year to pass clinical trials and get it up and running to make it somewhat suitable for the population. This is a rush job. This is a rush job. So in addition to all of the complications that we talked about before, I doubt that this would be somewhat helpful to the people. In fact, more harmful than it is helpful. So medication would be best. Of course, where, you know, people are arguing about whether or not hydroxychloroquine works, which has been proven that it doesn't. They've tried to mix hydroxychloroquine with azithromycin. That didn't work. So there's, arguments as far as that's concerned. The other treatment that they are utilizing at the moment is a technique that they used in the early 50s, beyond the 50s, like with the flu epidemic, where they utilized the antibodies from those that overcame the virus, giving it to those that are infected. That has shown to work in the past. I'm not sure if any cases have been shown to work now, but that's, that has helped. But as far as what I'm taking and as far as what we talked about, there are natural supplementation that one could take to boost the immune system to help, it do its job. Such as Super Lysine Plus, which is a product that I use. It's a combination of the amino acid called lysine with echinacea, propolis, garlic, vitamin C. I believe that is it. You have your vitamin D. You have your, it goes down the line. Your antioxidants, which come from berries, anti-inflammatory fruits and vegetables, anything that you could think of that boosts the immunity, but also has anti-inflammatory and antiviral effects to it. One could take, one should take. There are papers being published right now scientifically that has shown increased effective impact of vitamin D on being able to treat the virus. So vitamin D, papers are being published now. Vitamin D is highly effective. Vitamin C, highly effective. Lysine, highly effective. People are talking about interferon, highly effective. So these things are out there, and these things I believe individuals should be able to take in their homes to boost their immunity. And with that, outside of having underlying complications, they should be part of that 80% that have mild symptoms and or be asymptomatic.
What about the HIV protocols and treatments? Because we're dealing with a virus that seems to be very tricky. Do you think that the HIV medications and protocols that are already on the market can help with this virus?
No, and not even in my professional opinion. No, it has proven not to be effective, because if it was, there wouldn't be a need to dive into these other medications that they've been diving into, such as anti-malarial drugs, lupus drugs. Like if these things, or if that particularly the HIV protocol worked, it wouldn't be a need to have gone to this length and prove that even this does not work or have an effect on the virus itself. So in my opinion, no.
No. So let's now I want to definitely bring this into the conversation. What about how to eat to live? What about fasting? What is it about how to eat to live or fasting, in addition to taking the vitamin D, the elderberry, the lysine? I've been recommending or suggesting to people that have asked me, I've been telling them about mushroom therapy, things like power mushrooms. There's a product that I'm using personally called Pure Defense, which is an upper respiratory formula with NAC. So in addition to taking these supplements and herbs, and I have people calling me, telling me they're taking sea moss and soursop and and a combination of all of these things. Do you think, in your opinion, as a scientist, as a virologist, that the diet of the How to Eat to Live by the Honorable Elijah Muhammad, fasting, will help. And especially in lieu of the fact that now we're getting ready to come up to Ramadan, right? So, and it always surprises me that during Ramadan or during the season of fasting, people's health levels or numbers seem to do better than when they're not fasting. Can we talk chop it up a little bit about that?
Yes. So I'm a huge fan of How to Eat to Live, not just because I was born and raised in a nation, but because, being a molecular scientist, there's been a new field that has come to the forefront, and that is the study of the microbiome. Okay. And the microbiome for geneticists is very interesting to research because we understand from a physiology standpoint that 70% of the immune system lies within the gut. And the gut is primarily made up of good and bad bacteria, and it's all about the balance. So the balance is actually called the microbiome between the good and the bad bacteria. The good bacteria keeps the bad bacteria in check. And if the good bacteria dies off, the bad bacteria becomes pathogenic. So oftentimes what happens is that the immune system becomes shot, not because of a person's necessarily eating habit, but more so because the eating habit impacts the bad bacteria to the point that it proliferates and it overgrows and overtakes the good bacteria there, therefore making it pathogenic, right? And then it becomes pathogenic, the immune system takes a back seat and it becomes decreased in its ability to regulate the body because the microbiome is out of whack, it's off balance.
Right.
So How to Eat to Live talks about everything that's necessary to eat, everything and how to eat, because that's actually what's interesting. Not only tells you what to eat, but how to eat properly to regain balance of the microbiome for the immune system to work in its optimum capacity, right? So fasting, talks about the resetting of the immune system, the cleansing of the blood, the cleansing of the system, internal and then externally being shown, right? So everything from the staple food of the Nation of Islam being the navy bean soup, and we're taught that the navy bean has all of the mineral and vitamins necessary to thrive and survive on. Soup in itself is anti-inflammatory. It's a food that we eat that isn't mucus producing if you do it by the recipe that we were given. So everything about the navy bean soup and the recipe in itself would be everything that the body needs to regain optimal function in its immune response, right? Fasting is very important. What's interesting is that celebrities have come to the forefront, and Terry Crews being one of the first celebrities to come forth and say the reason that he got his body the way that he has his body, as many people would marvel and admire, is because of something called intermittent fasting. Intermittent fasting at that point was something that a lot of people did, but the Nation of Islam propagated and talked about since the 30s. And it was the idea of taking an interval of eating certain meals a day. So at a certain age, you can only eat a certain meal a day. And of course, above 18 or above, I believe it was 18. But at that time, we were taught to eat one meal a day. But the point is that intermittent fasting is very similar to that. It's very similar to the 2 meals, 1 meal a day situation. So that means you're taking 8 hours, 9 hours interval of time before eating your next meal. In a 24-hour day, depending on how that looks to a person, that's eating 2 meals or 1 meal a day. You see what I'm saying? So the idea is just like with How to Eat to Live, not burdening the digestive tract, and allowing the body to digest what's needed and to then reset and cleanse the blood so that the immune system could be at its optimal capacity. Fasting does that really well. Celebrities are now You know, they're utilizing that technique as something new, although it isn't new, but you see the results. You see the
Right.
results even in them. So, and then at that point, you start looking at scientific research. They start to backtrack on the idea of, so you don't have to eat your small 5 meals a day. You don't have to eat your 3 large meals a day. Intermittent fasting may actually be healthier for you. So you have scientific research that backs and supports that idea for something that How to Eat to Live been teaching and been proselytizing for years, decades.
Right. Right. Because I mean, the society that we live in is very confusing. I get clients that come to see me, you know, in the last 10 years, and there's just so much confusion. They're so confused about how to eat, you know, what to eat. A lot of them don't understand that the foods that we're eating is what is causing us to be sick.
Right.
And the amount of food that we eat and the time that we eat these foods can ultimately put us in a situation where our immune system could become compromised.
Right.
And so even the way that we farm our foods in America is in direct contradiction to biblical dictates, where it said that we should rotate the crops every 7 years so that those nutrients in the soil could get into the food. If Monsanto is your farmer, if Monsanto is feeding you, you know, Monsanto could care less about health and wellness. Monsanto cares about profits. So in the long run, in terms of the implementing the How to Eat to Live in one's lifestyle, what do you think in terms of us starting to grow our own food, or to connect with farmers, so that we could start to grow our own food and make sure that we're getting the right types of foods in our diet? What would be your take on that? I know we kind of got away a little bit from the COVID-19, but I mean, I know that this is all one and the same. The immune system, if the immune system is strong,
Yeah.
when we are fasting and we are implementing a diet that was given to us by the Honorable Elijah Muhammad, from God himself in person, then what, you know, do you think that this is the proper time? I mean, once things get better, you know, if they do get better, do you think that we should start, you know, looking at farming and growing our own fruits and vegetables and crops and things of that nature?
Of course. The Most Honorable Elijah Muhammad taught us the importance of doing for self, but doing for self wasn't just something regarding financial stability outside of the economic system that we thrive in. It was also for our livelihood, so growing our own food falls directly in line with that. The only issue is that most of us find it insignificant. We find it beneath us, and we have lost connection with the idea of farming to the point where the master farmers or those that used to till the land, we no longer have those techniques anymore. We used to be masters in having green thumbs to grow our own crops, but yet even after the industrialization of America, most of us in the North, we found that belittling to the point where it's beneath our intellect, and therefore the assembly line and corporations and manufacturing and all of those jobs became the important techniques and to learn. However, I think now more important than ever, it shows us that in a time of potential famine, or as these markets are shutting down, there are reports that are reaching the people now that are saying meat markets, Tyson, places are being shut down. Why? Because workers have either died or meat has been contaminated with the virus, so forth. So, but what does that tell you regarding how you are going to receive your meat if those things are shut down? You see what I'm saying? And then trucks aren't able to travel to and fro the country. Crops aren't being transported into the supermarkets in time, and so forth and so on. I mean, what are you then going to do if you do not have the ability to grow your own food or have connection with one that is able to grow their own food, which is another thing, right? So even if you do not have the capabilities of growing your own food or the knowledge wherewithal, right, you do have to be resourceful. So, you know, being underneath of Dr. Aleem, who's my mentor, you know, my uncle, he taught us the importance of befriending those of the Amish community. So even those of the Amish community, from there where we get our raw milk from, building that line of friendship, having friendships in all walks of life, is very important to the idea of sustaining at least food grown from the ground and being able to bring it to your home. Those type of connections are not only important, but you find in times like this to be it's mandatory, right? So if you cannot do it yourself, then having that connection with someone who can is equally important. And that falls right in line with how to eat to live too. To further on that notion, to conclude this point, you know, Dr. Aleem has taught us, you know, back in the days when I was one of the coordinators for the NOISA at Howard University, we learned the importance of urban farming. So a lot of us that live in the inner city communities, we suffer from not being or having access to farmland or to acres of land. And somehow that impacting us to the point where we feel as if we cannot grow anything because we don't have the land. However, there was a new technology introduced called urban farming and a hoop house. And I'm not sure if you recall it per se, but being able to create a hoop house for no more than $1,200, you not only can grow your own food in temperature controlled environments, grow your own compost, right? Or make your own compost, grow your own food in temperature controlled environments, right? So anything that you could think of that you will want to grow, if you have, even if it's concrete, even in concrete, you can build a hoop house and be able to grow any of these vegetables and fruits that we're talking about to sustain yourself. And in Baltimore, Maryland, I know of at least 2 hoop houses that exist both on the east and west side in Maryland and all over the world. You know, there are hoop houses. There are hoop houses, and it doesn't take anything more than $1,200 to build. So, you know, urban farming is the solution for those that believe because you live in the inner city and don't have access to acres of land, you can't substantiate yourself with your own food.
Let me ask you this question, and I mean, I've heard this. Honorable Minister Louis Farrakhan had mentioned this in one of his speeches that we need to get out of the cities, and you know, one of the worst places that we possibly could be, when things get really bad, is to be in the cities. What's your take? And I'm feeling this more and more lately, that perhaps moving out into the country or moving back into the rural areas,
right?
Not only from a farming standpoint or growing our own food standpoint, but just the quality of the air. One of the things that some of my colleagues in California have expressed with me, and I don't know if you've noticed this yourself, is that in Los Angeles, the air quality has gotten better because people are not driving as much. And the air quality has gotten a lot better because people are not driving, they're not going out as much. So do you think, you know, that there may be and even with the virus, because of the distancing and the rural distancing and what rural living tends to do, do you think that there would be a movement of people wanting to go back into the countryside or moving out of the urban areas?
To be honest with you, I'm gonna be very honest with you. From a scientific perspective and the lens that I look out at the population, like I said, I deal with population genetics.
Mm-hmm.
And in population science, it has gotten me to believe that this is just, now when you say movement, you're talking about a collection of individuals with a like mindset that move towards a common goal. I believe for the most part, people are looking at this as circumstantial. They are not even looking at the benefits of what have occurred or what has occurred since they've been in the house. They're not looking at that. I don't even think they notice or see the earth around them healing. I don't even think they see that. I think they're so focused and tunnel visioned on the idea that they are unable to do what they want to do.
Right.
And therefore, as far as the answer to your question, do I believe it'll be a movement? Maybe a small portion of us, yes. But a collective in unison, no, because
Done.
they'll look at it as just a circumstantial situation that they shouldn't have been in the first place. And so they won't look at it as an opportunity to learn and see how we can live in synergy and live in harmony with the earth, with it healing and us still doing our daily activities.
Right.
I don't think they'll see that. I think they'll see the opportunity to go back doing to what they wanted to do. And in fact, it's going to hit so hard after this is all over, they're going to overcompensate. They're going to overcompensate, and the earth may go back to the condition that it was before, if not worse. So,
so you look at this as a cleansing, as Allah, kind of Allah putting this into the universe, and kind of like it's a cleansing for the earth, giving the earth the opportunity to cleanse itself.
See, here's the thing, regardless of how one wants to look at it, if one were to just look at reports, just look at the reports out from the smog to the clarity of the water to the ozone layer. I mean, the reports aren't lying.
Right.
They aren't lying. I think it's indicative that human beings are the culprits behind the very thing that they feel as if they need to fix. They feel as if the earth itself is they believe the earth is such a horrendous form, in such a horrendous, state, that they need to fix it and don't know how. However, I believe now they understand how. I think now they see how they could possibly be of a benefit to healing the earth, and that the earth will heal itself. It's self-replenishing.
Do you think that's gonna make a difference, though? I mean, the situation, because I mean, just look at it from a standpoint right now. State government, the president of the United States, Donald Trump, he seems to be in a rush to get back to business as normal, business as usual. He keeps pointing out the fact that, this is the largest economy in the world. I'm not going to shut down the largest economy in the world for a virus. So it seems like there are people who are like-minded, who are looking more at profit and greed and money, okay, as opposed to ecology, as opposed to our drinking water not being poisoned, in terms of our air being a better quality. I mean, this is what I'm hearing and seeing. And all along, what you're saying is correct. I think people do want to get back to work. This has definitely affected a lot of people economically, but at the same time, they're not looking at the benefits that this has brought about. If you want to call it beneficial, in a sense, us being kind of in the quarantine, has been some benefits to and being quarantined, besides the fact that we've been able to preserve our lives. But So what is your take on that?
On the fact that the government doesn't care.
Well, I mean, and let me say this. Let me ask you this, because I mean, we're just chopping it up here a little bit. I mean, people are calling and asking me, you know, Dr. Ishmael, what should I do? And affectionately, that's what they call me, right? And I'll say, look, I'm not gonna tell you to go back out there and start mixing with people and going on the beach, right? and getting hooked up with, go to concerts and do. I'm not telling you to do that. I don't think that you should do that.
Right.
All right. And because again, the underlying sinister thing that I see going on is that this is all about this rush is about not the ecology of people, but more so profit, greed, money.
Right.
Yeah.
Yeah.
So,
That's it's very difficult to. But then again, so let's make a point clear, right? Let's clarify something. It's no mistake that such a capitalist society in which we live, even the human beings that thrive underneath of such a philosophy thinks similar to the philosophy that they thrive under. So
right.
under a capitalist society, sure, you could blame the government or blame America or the engendering or the inception of America based on capitalism, but the people are not that far different, you know. So in the people being not that far different, the idea is, how do I thrive? How do I become better? How do I compete in a capitalist society? With that being said, you're not thinking about, the earth or how to live in harmony with the ecosystem and none of that. Because at the end of the day, it doesn't make you money. It does not bring food to the table. It doesn't, to them at least, right? That's not the mindset of a capitalist. So that philosophy that was engendered in the inception of America, it trickled down to the people that thrive in that condition. Now, of course, there are some of us that do not believe and or think in that philosophy, and we do strive to live with the land rather than against it or depleting it of all of its resources for the sake of our own gain. But that's far and few in between. So, the economy and working and the 9 to 5, the assembly line, the industrialization, and all of that. I mean, it takes precedence. It takes precedence over the earth in which we live, although that shouldn't be the case. It does take precedence. You can see it in our actions, our daily routine.
Right.
This isn't, and by the way, this isn't the only situation that we have had that has caused human beings to look at, one, their humanity and come face to face with their mortality. This isn't the first situation we've had like this. So in regard to those two things that I just mentioned, you would hope that the lesson is being learned at this moment in time of how the earth can be of benefit to our survival and benefit to our healing just as much as we are of benefit and healing for the earth. It's synergistic at that point.
Right. Absolutely. So I want to, thank you so much for, I want to thank Brother Marcus X Hill for introducing the both of us. And we had a fabulous dialogue a few days ago with the Freemasons and the Lodge of Freemasons, which made me want to do this again with you, but more on a purely scientific level and more of a medical level and so on. And I also want to give a big shout out to Dr. Ali Muhammad, who is, was a mentor to many of us coming up in the Nation of Islam. And, you know, we should, you know, keep him in our prayers, and, you know, and understand that, you know, we are all one step away from going through things in our
Correct.
personal lives,
Correct.
and that we should not make mockery, and we should keep him in our prayers, especially going into this month of Ramadan, and that we should also try to implement the Messenger's Diet, How to Eat to Live, book 1 and book 2, to the best of our abilities. And in addition to the fact that we can also, you know, do some of these things that we talked about, like the elderberry,
Yeah.
you know, and the lysine and the vitamin D and the power mushrooms and the aster C and all of the other wonderful things to help boost our immune system. But all in all, the bottom line is that, you know, seek refuge in Allah, seek refuge in God, and pray, and you know, that, you know, that will come through this pandemic, as they're calling it. I'm calling it a plague, but some people are calling it a pandemic. So, any closing words you want to share, brother?
Yeah. You know, at the end of the day, Dr. Elaine, my mentor, my uncle, you know, who I love deeply, you know, he has taught me so much. And one of the products that he is selling right now, because he's too in the health professional field, he looks good, he sounds good, and I believe it's due to the product that he's selling, and it's the green powder. So one could go to his website or go to his Instagram to look at his green powder, which has 2 ingredients in it that I believe would be highly beneficial for those that may not be on CMOS or don't prefer CMOS or whatever the case may be. But chlorella and spirulina,
Yes.
those two ingredients he has in his green powder, and I believe it has been properly named now Add Life. So one could easily contact him, see him on his Instagram to get that powder. And it's a green powder full of, you know, your minerals, vitamins, everything you would need, in addition to the green vegetables for those that do not eat their vegetables on a consistent basis. It is good for that. And yeah, you know, chlorella and spirulina are superfoods as well. So um that's one of the things that I would say, in addition to your echinacea, your vitamin C. One, you know, one you I don't believe that spending X amount of dollars would be of any harm to you for the sake of your health, especially in this time. So.
Right. Right. Wonderful. Excellent. And I'm also gonna, you know, keep you in my prayers, brother. You know, being that you are on the front lines and you're working in this as a research virologist and molecular virologist, and we know that in this day and time, so many, when you start talking outside of the box, you tend to end up being a target, in some cases, you know, like Dr. Ali, you know, and other people. We just lost Dr. Lila Africa. He just passed away. We lost Dr. Sabi a few years ago, and many of the other holistic practitioners and courageous doctors and scientists have pretty much gone underground, or are not really saying too much because of, you know, for fear of losing their life or their career or things of that nature. So I want to commend you for taking the time out today to, you know, sit down and chop it up, and hopefully we'll get this information out to some folks, and hopefully they'll be able to benefit from it.
Absolutely, absolutely, and I'm definitely honored to be on this podcast with you, face to face, during the social distancing. It's very important that we discuss topics of this magnitude with as many people as
Yes.
possible. You know, I'm a big proponent behind the idea of being rooted in science. I don't particularly share too much speculation. I share with individuals what has been documented, what's evidence, what has been provided as proof of principle, and also my own experiences. Like I said before, I've worked with viruses in the past, from adenoviruses to XMRV, which many of you have never heard of. Hopefully you never hear of, but that's another conversation for another time. To say the very least, that if ever a time like this comes again where we are able to talk, when we can talk about the theories that exist. We can talk about the conspiracy theories, where they're rooted in, the truth of it, the falsehood of it. We can dive into all of that, but I thought that it sets precedence to talk about the science first and talk about the need to protect oneself and defend themselves in the current circumstance. Later, we can discuss those other things.
Yes, absolutely. I mean, as I said earlier, I think that in the future, our nation needs to do a better job at identifying our qualified personnel that we have in our nation. Because as I said again, just as a fluke, Brother Marcus put us together, and I had no idea of your background and what you brought to the table. And I find that a lot. I meet a lot of people throughout the nation that have backgrounds that are just absolutely like, wow, you do that? I had no idea. We could benefit from that, and so certainly someone of your qualifications and background could have definitely been a benefit for our community, our nation, so that we could have somebody that that's on our side, that's going to filter out all of the fluff,
Yeah.
and so that's, I think, is very, very important, and we need to do a better job of that in the future going forward. And we're growing, and those that comes with growing pains. But definitely, I really appreciated this time that we took today. I hope that we were able to upload it and let certain individuals in our community will benefit from it at their own leisure. And be able to make good decisions going forward.
Yes, sir. It's an honor. All praise is due to Allah, and I pray that I'm able to be of benefit to our people in the near future, nation,
Definitely.
however it may turn out to be.
You definitely were a benefit for me, because I was like, a lot of things that you shared I didn't know, and I thank you for that, certainly. So I pray that we can help this go out and get a benefit to other people as well. So praise be to Allah, my brother, and may Allah bless you and your family. And I hope to see you again, and we'll speak again very shortly.
Yes, sir. Pleasure is mine, and by Allah's permission, we'll talk with each other again. And peace and blessings to your family. May you all stay in health and strong.
Happy Ramadan to you, my brother.
Ramadan Mubarak.
Ramadan Kareem. Salam alaikum.
Wa salam.
Right, wonderful.